Hi, welcome to Future Nurse YouTube channel. Please subscribe and support my YouTube channel for previous year question papers and solved question papers and multiple choice questions for the upcoming AIIMS NORCET 6.0 in 2024. So let's start this video. Which hormone is responsible for milk ejection reflex? Options: prolactin, oxytocin, estrogen, progesterone. So the main hormone responsible for milk ejection reflex is oxytocin. Next question: oxytocin hormone is secreted by. So from where oxytocin hormone is secreted? Options: anterior lobe of pituitary gland, posterior lobe of pituitary gland, hypothalamus, and ovary. So the correct answer is hypothalamus. Which endocrine gland is situated in the lower part of neck on the thyroid cartilage? So options are pituitary gland, adrenal gland, thyroid gland, pineal gland. So correct option is option C, thyroid gland. Next question: a 3-month-old infant has been diagnosed with congenital hypothyroidism. What is the problem effect on the child's future if treatment is not begin in early infancy? So options are lifelong myxedema, more severe mental retardation, spastic paralysis, repeated episode of thyrotoxicosis. So the correct option is more severe mental retardation. Next question: in a patient who has history of hypothyroidism, which of the following characteristics of the skin of the patient is a relevant finding on examination? So options are smooth, dry, flushed, moist. So correct option is option B, dry. Next question: the classic signs and symptoms of hypoglycemia include confusion, hypertension and nausea, headache, weakness and irritability, bradycardia, vomiting and hypotension, diplopia, restlessness and tachypnea. So correct option is option B, technique, weakness and irritability. When the patient is having hypoglycemia, the signs and symptoms include headache, weakness and irritability. Next question: a 35-year-old male has been an insulin dependent diabetic for last 5 years and is now unable to urinate. The following is mostly likely to respect. Options: atherosclerosis, diabetic nephropathy, autonomic neuropathy, somatic neuropathy. So correct option is autonomic neuropathy. Symptoms that may be experienced by patient in diabetic coma are options: sweating, hunger and trembling, pallor, headache and weakness, slow pulse and difficulty in breathing, hard dry skin, nausea, vomiting and drowsiness. So the question is symptoms that may be experienced by patient in diabetic coma is. So the main symptoms are hard dry skin, nausea, vomiting and drowsiness. Option D is the correct. So next, during hypoparathyroidism, serum calcium level is. So during hypoparathyroidism, the serum calcium will be, the options are increases, decreases, remain normal, no effect. So it will decrease. The serum calcium level during hypoparathyroidism will be decreases. The next question: body system that controls and coordinate all body activities. Options: endocrine, musculoskeletal, nervous, reproductive. So the correct answer: nervous. Next, part of brain that help in maintaining posture and equilibrium is? So options: medulla, cerebrum and thalamus. So the part of the brain that help in maintaining posture and equilibrium is, so answer is cerebellum. So this cerebellum, it's maintaining the posture and equilibrium of the body. So cerebellum is the right option. Next, which of the following is an autonomic reflex? Options: mass reflex, stumble reflex, as reflex, plantar reflex. So the correct answer, option A, mass reflex. Mass reflex is equals to autonomic reflex. Next, nerve supply to jaw occur by which nerve? So the main nerve which is supplied to the jaw is called, the options: temporal nerve, maxillary nerve, ophthalmic nerve and zygomatic nerve. So the nerve supplied to the jaw, which means in the face, means maxillary nerve. Which of the following is a specific investigation to detect seizures? So for seizures, which of the following investigation is done? Options: CT scan, MRI scan, EEG, X-ray. So the main investigation to detect seizures is option C, EEG. Next, a lethargic patient has fever, vomiting, headache, and the nurse has to prepare him for which one of the following procedure? So if the patient is having fever, vomiting and headache, so options: blood culture, lumbar puncture, CAT scan and ultrasound examination. So the answer is lumbar puncture. Next, when helping a stroke patient, nurse should assist on weak side, on stronger side, from behind, from back. So if the patient is having stroke, so this is the weaker part and this is the stronger side. So for right side of the body, if the stroke has been applied, means you should assist on which side of the body? So the answer is on weak side. Drug of choice for myasthenia gravis is, so which is the drug of choice for myasthenia gravis? Options: adrenaline, atropine, neostigmine, D, tuberculin. So options, so which is the correct? Neostigmine is the correct answer. Which drug used into hemodialysis to prevent blood clot? So during hemodialysis, so to prevent blood clot, which of the following drugs are used? Options: aspirin, warfarin, heparin, protamine. So they will use heparin, option C, heparin for hemodialysis patients to prevent the blood clot. Next, longest bone of the human body. So this is anatomical question. Longest bone of the human body is femur, humerus, tibia and fibula. As you all of know, the answer femur. Femur is the longest bone in the human body. Next, in a client in renal failure, which assessment finding may indicate hypocalcemia? Options: headache, serum calcium level of 5 MEq per liter, increased blood coagulation, diarrhea. So the correct answer, which is serum calcium level of 5 MEq per liter, is the correct answer. Which of the following is a retroperitoneal structure. So they are asking that which of the following is a retroperitoneal structure? The options are spleen, kidney, stomach, pancreas. So which of the following part is like a retroperitoneal structure? Answer is kidney, option B, which follows retroperitoneal structure. Next, osteoporosis is disease of. So osteoporosis is the disease of which of the following options? Skin, bones, brain and muscle. So osteoporosis means it's a disease of bones, option B. Next question, end of two bones is connected by. So they are asking, this is one type of bone, so this is another bone. End of two bones is connected by. So what do you call as this part? Means the options are muscles, tendons, ligament and cartilage. So the part between the end of two bones is called as ligament. So option C is the correct option. So last question, which muscles does not belong to hip joint? So psoas muscle, gluteal muscle, liquor muscle, tricep muscle. So which muscles does not belong to the hip joint? So tricep muscle, which do not included in the hip joint. So friends, we have came to the end of the video. So we will see and some of the few top trending multiple choice questions in the next video. So please subscribe and support my YouTube channel. So thank you.